A newborn girl presents at birth with a large tongue and right upper and lower extremities, as well as an umbilical bulge. A researcher wishes to study if there is any relationship between the presentation of this condition and maternal use of in vitro fertilization. The researcher finds hospital records of children born with and without the condition to find if there is any association. Which of the following best describes this study design? Choice A, case series. Choice B, cross-sectional. Choice C, retrospective cohort. Choice D, prospective cohort. Choice E, case control. Choice F, ecological study. Or choice G, randomized controlled trial. I'll wait 5 seconds and answer the question. So, pretty easy question, but just gotta get this sort of thing out of the way, right? So in this question, the actual condition isn't even important, but just for the record, this is Beckwith-Wiedemann syndrome. It's a Wilms tumor-associated condition where you see macroglossia, hemihyperplasia, omphalocele, among some other things, but those are the most buzzy things you tend to find. It's just one of those things that shows up from time to time. But putting that aside, this is a biostatistics question. So here you start with the disease, which is Beckwith-Wiedemann syndrome, and then you go looking for the exposure to try to establish if there is any kind of association. So if you start with a disease and look for exposure in an observational study, which is what this is, it's a case control study, so choice E is the correct answer. And questions like this are just testing you on your definitions, right? So let's just look at the other ones. Choice A, case series. This is used to describe when we have a group of patients, like literally we have a series of cases. They all have the same disease and we just group them together and kind of look at them together. No comparison group is used for this. So sometimes it's just for us to look at, maybe some possible trends among a disease. Outside of case reports, this is probably the weakest kind of study. Choice B, cross-sectional study. A cross-sectional study, you would assess disease and exposure at the same time rather than starting with one or the other. And you want to contrast that with choices C and D, cohort studies, where you start with the exposure and then you follow them to see if they get the disease. It can be retrospective where you look into the past to see if they developed the disease, or you follow the patients for a while into the future, which is a prospective cohort. It's really important that you know the difference between cross-sectional, cohort, and case control study. It's really just about you knowing your definitions, right? So cross-sectional, exposure and disease at the same time. Cohort study, you start with an exposure and you look for the disease. And case control study, you start with the disease and look for the exposures. It's not hard. Choice F, ecological study. Ecological studies are used to compare group-wide data, so this is more for like a public health thing, when we're comparing like counties against each other, or comparing countries, or even comparing entire populations. So you're looking at disease rates throughout different populations and then comparing them, something like that. That would be an ecological study. So mainly the thing you want to know is that if you get things where you're comparing one population against another instead of looking at individuals, that's an ecological study. So obviously in this question we're looking at individuals. Choice G, randomized controlled trial. I don't think I need to explain this too much. You just have to randomize patients into a non-intervention and intervention group, and you usually blind these studies and you just follow them along to see if the intervention is effective doing whatever it is you want it to do. Typically, this is the only one that comes up on USMLE that is filed under experimental study. Now, don't be too rigid with that wording, experimental study, because sometimes the NBME has questions where they write it in a really stupid way, where they say they ask you about an experiment, but what they're actually asking you about is an observational study. You can argue that maybe that's an erratum, the questions that do that, but my point is more that even without nitpicking at the actual wording of the question, it's usually easy to tell these apart just from looking at the study design. So like I already said, you gotta know the difference between cross-sectional, cohort, and case control studies. Cross-sectional, exposure and disease at the same time. Cohort, you look at the exposure and then you go look for the disease. Case control, you look for the disease first, you get groups of the people with and without the disease, and then you go look for the exposure. It's just testing you on definitions. I hope you found this video helpful. I'll see you in the next one.